everyone, it's Dr. Eric, the fitness physician, where I talk about all things related to hormonal fitness, muscle medicine, and more, hormone optimization, peptide therapy, longevity, anti-aging, and much, much more. So, been through a slurry of conferences late, and I'm going to give a shout out to World Lake Medical and SSRP for some awesome education. And again, just going to try to pass some of this knowledge along to you as well. Kind of give you the summary. Obviously, the details are way beyond the scope of this. These are hours of lectures that would take, and that's why I just spend, an hour or so with my patients doing one-on-one consultations, doing a deep dive into their physiology, biochemistry, genetics, and much, much more. So, for specifically talking about hormone optimization and testosterone in particular, I'm going to do multiple videos on the relationship between testosterone, coronary artery disease, and cardiovascular disease. We know that cardiovascular disease is the #1 killer of men and women, and there are many ways to achieve this. To reduce this and improve the #1 killer of men and women everywhere. Many ways to do this, of course, lifestyle, fasting, etc. Hormone optimization is key for this. And we're going to talk about the lipid hypothesis and we're going to talk about why it's not working, right? It's not all about statins and lowering that cholesterol, because people with super low cholesterol are still getting heart attacks and vascular disease. There's another reason, and there's many reasons for this. In the Journal of Life Science, there's a nice article relating testosterone, talking about the clearance of cholesterol. And basically, it's not just about cholesterol, and again, I'll talk about this in future videos, but there's a clear relationship between lower testosterone, increased cardiovascular disease, and mortality. And a lot of this has to do not only with cholesterol clearance from the endothelium, but the anti-inflammatory effects, lipid improvements, and reduction of visceral fat, and much, much more. So basically, there's a study that talked about how there's improved clearance from the endothelium with optimal levels of testosterone. And because basically testosterone activates LXR alpha, the liver X receptor. And it's especially in everyone, but especially people who have ApoE, and it activates these other proteins and enzyme systems, the ApoE, fatty acid synthase, the ABCA, and steroid regulatory binding protein factors, and more. I said that really quick, but I don't want to. One of these, they're just long names. I just want to give you the gist of it, that there's multiple enzymes in this process. And again, this is a real deep dive into the biochemistry. I just want to kind of give you the view from 30,000, and we're going to dig in over the next several videos. But the bottom line is these receptors, this LXR, is the nuclear master regulator of cellular cholesterol homeostasis and regulation, inflammation, and much, much more. So by activating, what this does is basically improves the clearance, the removal of the ApoB protein from the endothelium. And so it's not just about LDL and HDL, it's much, much more detailed than that. And this is one of the things it does, improves this clearance through this LXR receptor. And by doing this, it's going to improve, again, of course, downstream, improve cardiovascular disease and mortality. It has to do with not just with cholesterol, but again, improvement of endothelial dysfunction. That's one of the key things that happens. Cardiovascular disease is not just about cholesterol, but what happens. There's macrophage activation, there's inflammation, there's foam cell formation, neutrophil infiltration, secondary inflammatories, inflammatory cytokines, and much, much more. And again, inflammation. And there's many, many steps to this. So this is one of the things that does, and this might be why that, explain the anti-atherogenic effects of that we see with this clinically with testosterone optimization. So I thought this was a really cool article. I'd not heard of this before. And again, it's a deep dive, but I just want to give you the background. I'm going to dig into how this works over the next several videos. So just yet another way that we can improve this and improve this #1 killer by improving our hormone optimization with hormonal fitness. So please reach out to me, let me know what else you want to learn about. This is why you must work with a trained clinician. Please don't just follow cookbook protocols from these cookie cutter clinics or non-medical trained people. I know there's a lot of great people out there who are giving good information, but you really need to work with a trained clinician or physician who has a background and long history of treating patients clinically and really doing deep dives into the hormonal science and much, much more. Something you can't just get from going to a course and reading a few books and articles. It's much deeper than that. And again, not that I know everything, I certainly don't, but there's definitely things I can do. And I see patients with this all the time, and I have to fix them, and I enjoy that. I love that, and I love when my patients get improvement. So my goal is to improve this and improve our cardiovascular health in all my patients, as many as I can. So anyway, like this video, share it, reach out to me, let me know what else you want to learn about, and stay tuned for future videos. I'm going to be doing many, many videos on this, and we're going to learn much, much more. So everyone have an awesome day. Remember, live to give back, do something nice for someone today, pass it forward, and we'll talk to you soon.